Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. Our mission is simple. We're searching for beneficial disruption in healthcare from emerging technologies. I'm very honored today. My guest is Aman Quandri. He's the CEO of AMSYS Blockchain and AMCHART Medical Record. Aman, thanks for joining us on the Tate Chronicles.
Well, appreciate you having me. Thanks for the intro.
Yeah, glad to. A few months back, I was at the annual HIMSS conference in Las Vegas. Spent some time with with some of your team looking at the medical record and hearing what they're doing in terms of blockchain and things like that. So I know there's an AMSYS kind of a corporate umbrella that involves many different things, many different industries and initiatives. But today we really want to focus on the blockchain and AMCHART and health records. And so the first question I'd like to direct your way is, what is the goal of AMCHART, and what problems are you attempting to address with it?
Yeah, that's a big question, but yeah, let me try to answer it as succinctly as I can. The main thing for me is I came from a clinician background, so I was in rehab, worked with a lot of multidisciplinary groups, and really saw the issues that we had with getting accurate medical records, timeliness of records, to be able to actually transport them on a regular basis. And even though while I was in practice, I thought that, hey, let's work on solving this problem, it was difficult when I was trying to do it in 2010 and and a few years after that, because technology was so expensive. But over the last couple of years, with the introduction of blockchain, with the introduction of newer ways of development, the barrier of entry is low. So the main problem I'm trying to solve, and as a group we're trying to solve, is the ability for a person, a patient, to have access to their medical record at any time. Not only that, for them to have ownership of their own healthcare data, which they currently do not. And that's a great summary, but there's a lot of underlying details that are required to get them to that point.
I understand. Sure. And so what you just mentioned there, Aman, is the fact that patient access to their own record. So is this the technology that you're involved with developing is not only patient-facing, or is it also something that providers would use to maybe document a clinical encounter?
Sure. So at both. So the main thing that we're starting with is the patient-facing portion, because that's that's the population that's underserved when it comes to having access to their data. But at the same time, we are building the provider-facing platform as part of the whole ecosystem of what AMCHART is.
Now, when we're talking about patient-facing, of course, we have these also National Coordinator, these certification standards for different EMRs, and EMRs have patient portals, and so many patients have numerous portals that they're having to try and go to, or they just give up and don't go to them. Do you have some way to kind of bring together that data? How is that data brought together so a patient maybe has only one view?
Yeah, so let's talk about that. So I guess I'll give you a brief overview of the ecosystem, and that may help you to understand what we're trying to do. So there's multiple ways of getting data in, right? So one is our mobile app, which are wellness tracker. And the wellness tracker is similar to other wellness trackers in the fact that you can get data from an Apple Watch or a Fitbit, but we're also integrating devices that you could have at home. Blood pressure, blood sugar. We're actually testing devices that aren't even available in the United States yet, like non-invasive, non-prick blood glucometers to reduce the barrier of entry. So what we're trying to do is, that's one data aggregation point, and we want to bring it in to a central store, which is basically your personal health record, which is in essence your patient portal or your dashboard. So everything that comes from the mobile app will eventually go to the patient health record itself, the AMCHART PHR. Now, that PHR will also allow for access to other medical records that we're connected to. So let's say Apple Health Kit. Let's say it's connected to various EMRs like Athena or Epic or whatever. And we're also trying to make connectivities through HIE. So our goal of the platform is to be open. So we're going to create as many APIs as possible and release those endpoints for people to be connected to us. We're going to have HL7 and FHIR integration, and so that becomes the aggregation point. And now the third part of that is the provider-facing, the AMCHART EMR. That is going to allow for physicians to not only be able to see a snapshot of your dashboard, which has all your vitals on a regular basis from your PHR, but any encounters that they do through the EMR also get uploaded to there. Current patient portals only show you like your appointment and maybe some of your labs or whatever. Our goal is your patient health record should allow you to be able to see everything in a snapshot. And as we build out our analytics and AI platform, we want that artificial intelligence to also provide you with insight in your own data. If you have XYZ going on, maybe it pops up and says, hey, have you thought about these things? Or maybe you have 10 medications that you're on, and this clinical decision-making tree will say, don't take all these medications at once. You need to spread them out so you have the best efficacy for your drugs. And so our goal is that patient health record to be more than just something you log into and see a few pieces of information. It should be something you interact with regularly, just like you do with you go check your bank account and see what's going on with it, or you check your investment portfolio. Your healthcare data is an investment too, because it's data you build over time.
One thing you mentioned there is your wellness tracker. And yes. When I was doing some research on your company, I downloaded it last week, and I've been working with it, and I like it. It's very well done. And in addition, it seems very easy, and AMSYS is actually asking for user feedback, what would make it better, what would like to be done, and I really appreciate that. So I'm actively using it. And so that wellness tracker really gets us in the category of patient-reported health information, whether it's blood sugar levels or how many steps I took today, or however it goes. And so that's really the patient-generated health data that flows, from what I understand you, to their larger personal health record that will have that information, but also information from providers they may be seeing, lab tests they're having done, things like that.
Correct, and that's all permission-based. So as long as you give permission for us to expose that to your physician, then it gets exposed to them. If you don't want to do that, remember, we want you to have control of your data. So this is. And on going back on that, the feedback has been really, really valuable from people. In fact, we are going to make some pretty wholesale changes based on about 200 or so feedback items that we've received that even we didn't think about from the user experience, but having it in live hands makes a difference. Yeah.
Sure. Well, the AMCHART, that's going to be the, clinical documentation application that providers use. Is that going to be going through ONC certification?
That is our plan, yes. So what we've decided to do is that the rules and regulations, in the U.S. are stringent, but also necessary for getting the right feedback. For what providers need to provide, right? For insurance purposes, et cetera. But we also want to test this platform out. So, as the timeline goes, we have our beta iOS app. Our Android app should be out in the next couple of months, and then the wholesale changes to the iOS app will also be out at that time. The PHR, the personal health record, the initial phase of it is going to actually be out, let's say, I'm hoping in 2.5 weeks. So people can start testing it out and building a simple record.
That's soon.
Yeah, and we're going to announce that. And then the phase 1 of the actual provider-facing should be second week of October. So these are all time frames that are actually coming up. So and they're right around the corner. But our goal with it was like, how do you test these on live patients? Because getting it into a system is tough, right, at times. And so as a group, since we've been around for 15 years, we decided that we would create our own clinical pathways and clinical workflows. So as of a few weeks ago, AMSYS Group started the AMSYS Heart and Diabetes Clinic in Mumbai, India. And we actually start accepting patients next week. So we're going to test these initiatives there, refine the workflows, refine processes, get rid of all the bugs in an environment where we don't have to deal with certain rules and regulations. And when they're done, then we're going to bring over a clean setup to go towards ONC certification.
I see. Now, we've been talking for about 10 minutes, and I can count on one hand the number of times we've mentioned blockchain. So how was your your health data, what's being stored on a blockchain? Is it public blockchain, private, hybrid? What's the interaction between your applications and a blockchain foundation?
Sure. Our blockchain is a private permissioned, so we don't utilize the public chain, mainly because we don't feel like the public chains, and that's an argument people will make, is like some are on both sides, right? If you're not a public blockchain, you're not truly a blockchain company, right? But our goal is simple, is that if we wait for true public blockchains to be safe and secure and to be tested, then we're sitting on the sidelines for a while. And our goal with it was to show that data can move on a blockchain. And so currently we're built on a Hyperledger Sawtooth framework, which is an Intel-backed product. And then we're utilizing an ERC20 token for the incentive part. We're not utilizing it for the network, but just for the incentive. So we classify data and identify de-identified data, and those transaction hashes are stored on the blockchain for de-identified data at this time. And then, our goal is to be able to query off those and be able to define those subsets of data that are needed for people to interact with it. So the eventual goal is not only for incentivizing our patients, but as they build these data sets, we also need to be able to expose them with their permission for clinical trial matching, for research purposes, et cetera, which is another way that they can be incentivized to continue building their data sets. And so most of our data store is divided between distributed and a truly, a blockchain-based data store. And so we're going to use IPFS with a sharding mechanism for that side of it.
I got you. And so large data files, radiographic images, things like those are going to be stored. I guess there'll be some pointer on your private blockchain that points to them.
Correct. I mean, you don't ever want to use a blockchain at this point in time, especially public, to store any of that kind of data. It's not feasible. It's expensive, and it'll bog down the network, right? So you never
absolutely instantly. Well, what about the you mentioned incentivizing patients? Is this to if their weight goes down, or they have a diagnosis of hypertension and their blood pressure gets in that normal range, do they receive incentives? What's the incentivizing based upon?
Absolutely. So those are absolutely some of the ones that we thought about. So we want to do a few different things. So one of the things to build a robust data set and have that so we can match you to pharmaceutical research and all that stuff is to maintain those vital signs on a regular basis. So simple, if you get let's say a blood glucometer in your home and you take your blood pressure, or your blood sugar, maybe 14 days in a row, guess what? You get awarded some wellness points if you do the same thing with blood pressure, blood sugar, or if you put in your diet plan for 30 days straight, you're gonna go ahead and get some wellness points, and those wellness points can then equate to a kind of reward system like an airline program where you can take it now into a marketplace, and you can go ahead and exchange it for gift cards or travel or airline miles. And the other thing that we're doing is our marketplace will also be for other goods and services too that are other emerging technology companies. So if we're working, we've got 2 or 3 organizations that do fair marketplace pricing, right? So maybe you're in New York with this one organization. You're like, I've built up these points and I need to get a blood test, or I need to go get a gym membership or whatever. They've already done the negotiation. You can use your points and transfer it over and now be able to pay for some of these goods and services that you're earning from just doing what you need to do, which is monitor your health on a regular basis, right? So that's what's happening there too. The other thing is that if you maintain vital signs on a regular basis or keep track of your health and eating, we can, again, with your permission, expose that to your health plan. And what could, we've talked to other health insurance companies, says, hey, look, if we know what's going on with them, if they're dropping their blood pressure, if their blood sugar is staying in a good range, and we can see that too, well, we'll lower their premiums, right? It's a benefit to a person to be able to get cost savings just from high premiums right now that we have based on these high deductible plans. So there could be a lot of different ways where a person benefits just from what they're doing on a day-to-day basis. Well,
one of the things that seems to have great potential for healthcare use cases, it involves the kind of expanded blockchain functionality around smart contracts, reimbursement, things like that. Are you utilizing any type of smart contracts in your technology?
We are. We're actually. Yeah, we do see potential for it, and we actually see potential for it in our partnerships that we're making. And so what we're trying to do is create a larger ecosystem of players that are blockchain or non-blockchain. I mean, or other emerging tech, which is AI or ML or IOMT. So all these organizations. So the goal for us is that can you use smart contracts to automate a lot of the nuances that are normally done in a regular day-to-day operation in medicine, right? So if you can get rid of the payment side, right? So if I send somebody through our marketplace to a provider that does fair market-based pricing, they get a blood test, right? They go to get a blood test. As soon as that blood test is completed, those results fall into their medical record in our platform. The smart contract triggers the actual movement of the funds into the lab's bank account, in essence, right? So the goal is right now, if I go to a lab, I give them my ID card, my insurance, and all that stuff. They may take them 30 to 60 or 90 days to get paid, right? Because of all the insurance stuff you have to deal with. If we're doing a fair marketplace pricing platform, and you just go use somebody through a marketplace, that thing gets done. You're talking about maybe 72 hours to get paid. And so smart contracts are good in that regards of getting rid of all the middlemen that are involved in the process of payments, posting, even credentialing, or all those avenues. So yes, we're looking at smart contracts not only from our own point of view on what we do through our incentive program, because for us it's like if you meet your incentives, then smart contract automatically kicks in and puts those wellness points in your account that you can then trade for goods and services. So all of us are looking at it.
I love the concept of smart contracts, and we don't even know where the potential of it is going to go. I know you travel a lot, you educate a lot, you do a lot of presentations, and so I would think that the demographics of people you speak to are everything from folks who don't know anything about blockchain or maybe think it's Bitcoin to people who are experts in the field, data scientists, people like that.
Sure.
And so what are kind of some of the kind of questions that I get asked all the time? Of course, it seems like a lot of people won't understand how blockchain works, even though they don't need to know. If there's going to be users, like users of your applications don't need to know how blockchain works. But it is interesting that just like in the early stages of the Internet, we're in the early stages of blockchain where people want to try and grasp it for whatever reason, even if they don't need to. But one question that comes up a lot is healthcare data protected? Now you're talking about a private blockchain, but on the public blockchain, or public blockchains, is the data safe there? How would you respond to a question like that?
I would probably say on a public chain, you'd have to understand what data is being stored there and how they're protecting that data. The thing about blockchain is pretty simple. I always say it's distributed trust. That's really what it is. What you're trying to do is take one piece of information and divide it in so many different ways that there's no single point of failure, right? That's the problem we have. And that's, if you go back to what's happened to certain medical record companies, they've had breaches because there's a single repository and that's a single point of failure. If I take, let's say, your social security number, and each one of those digits I can place in a node somewhere else, well, the difficulty for somebody to go into one node and get that piece of data, I've got one number. Now I've got to find the other 6 or 7 numbers to put it together, right? So to me, it's like as long as a public blockchain is actually sharding data, meaning putting data in multiple places at one time, just cutting it all up, then I think you actually have better security for your data going from a single point system to a multi-point system. Now, if you're just taking a transaction hash and you're just putting it there, or you're deciding that even you're putting identified data in one spot and even on a public chain, then I think you're still at risk. But there are a lot of companies out there who are figuring out that distributed data is and sharding of that data is probably the best mechanism to use. So are there public chains that are using it? Sure, and I think they're doing a fair job. I just don't trust them just yet. So that's why we're on a private permission system. So.
Right, and we're so early in the whole ecosystem of it. Now, you mentioned sharding. certainly with Ethereum, the blockchain network, with we mentioned that how slow it runs. It's necessary to have a copy of the entire blockchain in every node, and one way to speed up and scale it is this concept of sharding, where nodes don't have to have the full blockchain. They can just have pieces
Correct.
of blockchain. So it would not only enhance scalability, but also security.
Absolutely.
So,
absolutely.
Yeah.
And there are several good companies who are working on these trends, and I think that's where you're going to have to go if you really want to utilize a public chain. The thing you also have to think about not only is scaling and speed, but cost of those transactions, right? Right now, if I go into a system and say, hey, look, we're going to be on a public chain, and there's a cost associated with each transfer of information or access or whatever, then it's hard for adoption to take place. Where it's easier on a private network, we can say, hey, look, if I'm working with several health insurance companies, maybe they're our trusted node network. We can put it over, we can set up these nodes everywhere, and so our transaction speeds can be high, but then the transaction cost is little to nothing, and still we can shard that data to make sure it stays protected. So there's several different ways to architect this thing.
You've been, Aman, you've been traveling quite a bit, and I know you go to a lot of conferences. Any trends that you've seen in maybe the last few months that we need to know about blockchain development or healthcare and blockchain?
Well, I'll tell you this: there's a lot of companies that are pushing their efforts into understanding what blockchain is and what blockchain can do. But I think it's more of a convergence of data that people are looking at, which is blockchain, which is AI, which is machine learning, which is how to utilize all those in together. And I think that what you're going to find is that over the next year or so, blockchain enhancing AI is going to be really the next trend that you're seeing. I really feel that blockchain actually can help to create a more trustable data source for AI engines to really crunch and actually give you better clinical decision-making skills and stuff. So the two things that I see right now are blockchain and AI that are really, really big and working hand in hand. And that's leading to more people talking about precision medicine, leading to more people talking about how do we incorporate genomic data on a blockchain and then use that in AI platforms. So you're really seeing some interesting things going on in the space right now.
There are, I continue to be amazed at the escalating volume of blockchain conferences. And also we're starting, they're getting specialized. So there are a lot of blockchain healthcare conferences. So you can really dial in, and those are the ones that I've kind of gone to. I've got a clinical background like yourself. Now, have you, since blockchain development, smart contracts, and of course there's risk in smart contracts that we've been learning about, do you see any difficulty that there is enough developmental expertise out there to supply these companies with people who really know what they're doing on the code level, right? Smart contracts, for example.
The simple answer to that is no. We do not have enough developers to, whether it's healthcare or beyond, to really support all the projects that are out there. And I think a lot of these projects are learning on the fly. I mean, we have been, as a company, we ourselves have been really, really blessed with being around for so long that we could go and scour the market to find the right, the right people to be on our project. Even our CTO, I mean, he's in Michigan, and it took us a while to find him. But, to find a blockchain developer that has healthcare experience is ridiculously hard to find. And when you do find them, you hold on to them like grim death, right? You're just like, stay with us for as long as you can, please. And so it's taken us a while to build that team, but it's good.
And Man, there is nobody on the planet who has 5 years in healthcare blockchain development. There's nobody.
Right.
It's too new. Yeah.
Yeah.
So,
and it always bothers me when I see that a space that this young has so many, blockchain experts, right? That always gets me. I'm like, how are you an expert when this thing is like 2 years old? You need to have like 5 to 10 years of experience to really be considered the, subject matter expert or the top guy in your field. We don't ever claim to be ourselves, but it's interesting. And so I think that can lead to a segue of what we're trying to do as a whole, So there's a group of us that have gotten together, and we've created this thing called the Blockchain in Healthcare Global Initiative. And it is in conjunction with the IEEE, the ISTO, the Trade Organization Division, that our goal is to bring companies, organizations, academia together to try to create frameworks and rules and regulations and be able to create this large conglomeration of people who can be a networking avenue, but also to help lay those foundations for us to follow. There's going to be things that we have to think about, like you've been talking about, like data and blockchain. What happens with these big data lakes, and how do we ethically utilize that data in the right manner for patients? What about AI, and how do you make sure that AI initiatives are kept in good frameworks and in good guidelines, so that we do right by the patient and we don't have data leakage and we don't use data for the improper purposes? And so there's already a lot of people who are interested in this organization, from large Fortune 500 companies to academics from Yale and other places. So we're excited about the pathway of just kind of bringing people together, and that's going to help us to really expose people to, like, hey, who's got good developers, who has good legal frameworks, who has good ideas on compliance, and we can all bring it all in one place. And we're excited about that too.
Exactly, and I am too. And that's a perfect summation, and I can't believe it, but our time is totally up here. So that was a perfect way to bring it full circle. And so to our audience, thanks for joining us on this episode of the Tate Chronicles. I offer a special salute to my guest today, Aman Quandri. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors. Aman, have a good day.
You as well.
Thank you.